Hello, everybody, and welcome back into the Keep Boone Healthy Community Information Channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. Happy New Year. Thanks for joining us once again. We have two very important folks with us today as we talk about community vaccine distribution. It is on everyone's mind, so we have gone to the best sources that we've got to let you know where things stand, what comes next, and how it applies to you. So, as always, we've got Jennifer Greene, Director of Public Health for AppHealthCare, a longtime friend of the program, and Sean Burroughs, who is the Director of Pharmacy for Appalachian Regional Healthcare System. These are the two providers right now in our community that are administering vaccine. We are in the process right now of wrapping up 1A, the 1A phase, and we'll be soon moving into the next part of this vaccine distribution. So thought it would be a great time to bring these two folks in to let you know, number one, how things are going. Number two, how you can get your information best sorted to make sure that if you are eligible within this next group, that you've got the opportunity to get that vaccine, and then how each one of these organizations is taking different parts of the patient load, so to speak. So, Jen, let's first start with you. We have talked to you a lot, just in general, but a lot about vaccine here lately. If you could give folks maybe a status report on where things sit here in Watauga County about where the overall vaccination effort is and how it's been going in terms of implementing what the state is directing you and Appalachian Regional Healthcare System to do.
Yeah, so we are excited to be finally giving vaccine. It's such a great way to start the year that we were able to wrap up 2020 and begin this year with giving vaccine. And I think it's going well. We've been focused on the 1A population, which is really making sure that our healthcare personnel in the community who are at highest risk, which a lot of that falls to our hospital. All of those folks who are at highest risk get vaccinated. And then also the people who are in long-term care facilities, both the staff and the residents, get covered. So many of those are covered through our federal pharmacy program that you've probably heard about, but some were not. And so that's where we've been focused on our efforts in the last couple of weeks. And we look forward to going to 1B next week.
So as 1B gets ready to roll out, Jen, can you give us the quick recap of who all is included in what group within that phase?
So 1B includes, initially, we've got subgroups. So that's how we're going to approach it. And the reason for that is we want to make sure the people at highest risk get vaccinated first. So the first group in 1B are people 75 and older, regardless of your health condition. That's where we're going to be focusing on first, and that's where we start next week. Beyond there, we're going to be looking at essential workers and healthcare workers that haven't previously been vaccinated that are 50 and older, and then all other essential workers and healthcare workers after that. So if you can imagine subgroups within our phase, that's really what we're focused on. So initially, it's going to be people 75 and older.
Sean, I know that Appalachian Regional Healthcare System has a wide variety of practices. It's not just the hospital. It's not just one doctor's office. It is a true system. And with that, you've got access to a lot of patient records and are able to communicate with those patients very effectively. So how do you foresee the hospital being able to utilize, or the hospital system rather, being able to utilize that information to reach out to folks and let those know that as they are eligible at the beginning of this 1B group, that you will be able to start vaccinating next week? What does that process look like?
Yeah, and thanks for having me, David. And I will say that we have tried to collaborate with Jen and AppHealth to try to do a systematic rollout as opposed to one entity rolling it out 2 weeks in front of the other. So I think the plan is for us to roll out the week of January 11th. And what we initially are trying to do is reach out to Appalachian Regional Medical Associate patients that are over the age of 75, and that number is well over 8,000, and we don't have that many vaccines. So not only in the subgroup of over 75, we have to filter that even more. And so what we are going to be doing next week is trying to reach out to Appalachian Regional Medical Associate patients that are over the age of 75 that live in Watauga, Ashe, and Avery, and contact them to see if they can set up and schedule an appointment over the next couple weeks to receive the limited quantity of vaccine that we currently have.
I think it's another important point to bring up too, because it seems as though, especially in an area like ours where we're so close to two other states, people tend to grasp at information, but it's important to make sure that you've got North Carolina's information as North Carolina medical providers are administering this vaccine. So maybe Sean, can you tell us a bit about how vaccine is being distributed to the hospital system at this point? I'm sure it's very similar for the health department, but can you maybe talk a little bit about what that process looks like so people truly understand that this isn't just you've got an endless supply sitting there. You've got almost a rationed approach to this, correct?
Yeah, and that's one of the questions that we get the most right now is how do you get your vaccine? Why can't I get my vaccine? Why is it going so slow? This state's doing it differently than y'all are. And each state has allocated a different amount of vaccine to be distributed to all the hospitals and health departments in that state. So we get a different amount of vaccine than South Carolina, than Tennessee, than Florida. And based on what our allocation is, our health department, our state health department, North Carolina Health and Human Services, allocates vaccine to the different areas of the state depending on how bad they're being hit right now with COVID, how many hospitalizations they have. And so they use an algorithm to figure out how much vaccine each different entity in each different area gets. And so we get what we get, and we don't sit on it. And I know Jen doesn't either. We're trying to figure out the best way to roll out the vaccine that we get on a weekly basis as quickly and efficiently as possible. So, for example, this week we got 400 doses from the state. I don't know what we're going to get next week. I'll find that information out here in the next day or two. But each week you will get some allocation, and you might not get any, during the week, the next week either. So it's a week by week thing, and we're trying to do the best that we can to make sure everybody stays informed of what we get, when we get it, and when they're going to be able to get it.
And Jen, from the health department's perspective, understanding that as the county gets supply, I know you guys have been and have said this all along, have been coordinating with each other to make sure that everything from storage to deployment goes as smoothly as it possibly can. How are you processing that same kind of call for patients, if you will? ARMA's got a database. What are you and your team doing to make sure that you're able to communicate with the folks that are eligible to receive the vaccine at this point?
Yeah, thanks, David. So we've got a link on our website. You can go to AppHealthCare.com and find our COVID-19 page. That's where we are asking people to go. They can put their information in, and don't have to be 75 plus, but if they are, they're going to get outreach from us to schedule their appointment. And that's how we're going to manage, getting them scheduled. And we hope to have not just clinics at our health department, but community locations where people can get vaccine in the future.
Yeah, and that kind of leads into the next question. I know folks may be wondering, okay, if I'm in that 75 plus group and I'm ready to go and sign up for my appointment, what does that look like at this point in terms of location, in terms of, is that your doctor's office? Is that at the hospital? What can you allow for folks to be able to anticipate as maybe their name gets called here in the next few weeks?
Well, I think, first of all, if you're with the ARMA practice, follow their guidance in terms of how they're going to get their patients scheduled. And then otherwise, certainly we will happily tell people about vaccine clinics and give them links. But people who have email will get an email from us with the ability to schedule. We also call people if there are individuals who cannot or don't want to use internet-based way of reaching out. We're going to do phone calls. And we have a call center that's open to answer questions about upcoming clinics that might be offered in the community or scheduling questions.
And I will also keep the horn of each of your frequently asked questions documents, both available at apprhs.org and through the AppHealthCare website as well. If you've got a question about vaccine, anything, go and check those out first as you look at some of that information that may answer your question or give you maybe a more targeted way to ask that question when you do reach out to the call center. Sean, I know we've talked some about mass vaccine opportunities. We've heard that a lot in the news here. I know that the hospital system and the health department have been working on some potentials for future clinics and maybe mass gathering opportunities to facilitate that. What can you tell us about, again, not maybe necessarily date specific, but what you would like to do in the future in terms of getting some more of those larger opportunities to vaccinate, if you will?
Yeah, and this is really a combination effort with Jen and AppHealthCare. We're working on that together to try and to find a date and a location within the next couple weeks to be able to run a mass vaccination clinic where we could hit potentially 1,000 folks in either a drive-through or some other setting type of clinic. And we're working with local entities to find a spot where that'll work out. And I would say by the end of this week or early next week, we'll have more information on a potential location and date where we'll be able to do that. And I want to thank Jen as well, because the vaccine that we would utilize for that is actually AppHealthCare's vaccine that we're storing in our ultra-low freezer here at the hospital. So it really is, as we're talking about different appointments and different ways to get your vaccine, we're talking about a collaborative effort between ARHS and AppHealthCare to vaccinate our community together as quickly as possible.
And I know that we will take every effort that we've got and every opportunity that we have to continue to communicate different benchmarks through this process, along with you utilizing the Keep Boone Healthy channel you're watching this on, and many other methods that we've got through our access and others throughout the community. I think that you will hear a lot about vaccine deployment, no matter where you see it here over the next several weeks. So with that said, I would allow you both to leave us with maybe advice that you would give to that person that may be anxious about making sure that they are doing the right thing in the right place at the right time to make sure that they get their info in there for this first group. Sean, we'll start with you, and then Jen, what would you say to those folks at this point in time about making sure that they are indeed following the process the best way possible?
Yeah, I would just stress that this is a marathon. It's not a sprint. It was a sprint to get the vaccine to us, but it's going to be a marathon to roll it out based on the allocations that we get. The phases are going to run for many months into the summer, and just understand that everybody's waited this long to get a vaccine, and it'd be great if we could give it to everybody tomorrow, but that's not the way it's going to work. So just understand that we will vaccinate our population as quickly and efficiently as we possibly can. And just because that's everybody's question is, when can I get the vaccine? And am I eligible for it? And we're working on trying to get the message out. We don't want to provide misinformation either. So we want to get as much information, good information out between AppHealth and ARHS as quickly as possible. And we're going to get the vaccine out as quickly as we can. So just remain patient, remain vigilant with your 3 Ws, and it'll be here hopefully soon.
Jen, anything to add to that?
I'll just say I couldn't have said it better, and really appreciate the partnership with our friends over at Appalachian Regional Healthcare System. This is a community effort, so we are also, looking forward to more shots in arms. And in the meantime, I think Sean's right. Make sure we are all practicing our 3 Ws. Look for good, credible information is the other piece I would add. Make sure that when you are talking to your friends and family, that they're, if there's questions that come up, go to credible sites. Our 2 websites are great places to go, as well as the Department of Health and Human Services, or CDC. But that's really where we should be gleaning our information, and not from other places that might not be accurate.
You know, you bring up a great point. Maybe one more quick question for you, Jen. I know that we've talked at times about other providers being able to become part of this process and helping to deploy vaccine, not just the health department and the hospital system. What does that timeline look like? Are there certain benchmarks that we're trying to clear within the state's guidance to you before you know, some of the other folks that are ready, willing, and able right now to help with that will be able to do so?
Yeah, so there's a couple of things. One is we're organizing an effort, together with our partners on how you can plug in if you want to volunteer or get involved. But then also, we're going to be looking for information from the Department of Health and Human Services when it's okay to add additional providers. There will be an opportunity for other healthcare providers to enroll, but that's a federally managed process. I think Sean said it well when he said it's going to be a little bit of a marathon, because part of the challenge is the state having the certain amount of allotted vaccine that they can send to us. So we're going to have to be patient there.
Well, certainly thank you both for taking time out of your very busy schedules to share some information with us here, and we'll extend you both the opportunity to come back on here at any point in time over the next several months to update this process, and best to you and your staffs for what has continued to be just heroic work here in our community to help us stay as healthy as possible during these times. So again, we'll share links in the video chat underneath the page here on Facebook, as well as send that out a number of different ways, and hopefully everybody can get access to that good information that Jen mentioned, and everybody will be able to stay up to date with credible information as best as possible. So thanks again to you both, and we look forward to talking to you again real soon.
Thanks, David.
Thanks, David.
All right.